Some people worry about coming to the emergency department. If you're a youth under the age of 18, or the parent of a youth under the age of 18, you hope you never have to go to the emergency department. But if you're struggling with a mental health crisis, we're here if you need us. When you arrive in the emergency department at McMaster Children's Hospital, you will first check in at the registration desk. Then you'll be triaged by an emergency department nurse and determined to be medically healthy. You will see a physician and maybe also a social worker.
Hi, my name is Amna Mirza and I'm a social worker here at McMaster Children's Hospital Emergency Department.
Hi, I'm Dr. Torki and I'm the emergency physician here at McMaster Children's Hospital.
Together or separately, we will be asking you questions about how you are feeling,
What you're thinking.
and if you're feeling safe at the time of our assessment.
We'll also ask your caregivers some questions about your health.
We know that crises come and go, even thoughts about ending your life. Sometimes just being in hospital can make things feel better. That doesn't mean that your visit to the emergency department was a waste of time. That's just something that happens sometimes, and that's okay. If you are safe enough to leave hospital, you may be given some local resources or complete a safety plan should those thoughts or feelings come back. If you need a more specialized assessment, you may be referred to the mental health assessment unit in the emergency department.
Hi, my name is Ashley Bonaventura and I am a social worker with the Mental Health Assessment Unit here at McMaster Children's Hospital. With us, you will receive an in-depth risk assessment completed by a team of professionals including social workers, nurses, and child and youth workers.
It's important to know that this is not a psychiatric assessment. You may or may not see a psychiatrist during your visit, but a psychiatrist will always be involved in your care. It's also important to know that your medications will not be changed during your visit to the emergency department. But sometimes the psychiatrist might make medication recommendations to your family doctor. Your situation will be discussed with the team who will decide what should happen next. The pros and cons of staying in hospital versus going home will be considered, and there's many things that we think about when we make this decision. The main reason to stay in hospital would be to keep you safe, so we take that decision very seriously. If it is decided that you will stay in hospital, the team will talk to you about what that will look like. Before leaving the mental health assessment unit, you will create a detailed safety plan with a member of our team. You will also be connected to local resources should that be needed. Sometimes a visit to the emergency department is a one-time thing, but other people might come back. Every visit is treated as a new assessment, meaning that we will ask you many of the same questions. This is done to make sure that we have all of the information we need to make the best decision about your care at that time. We know that lasting change happens when youth are in treatment and living their lives. So getting you connected with local resources, including therapy, is really important to us. Your local contact agency can help connect you to these resources, and the numbers are listed below. Thank you. We're here if you need us.